Wow.
Hi, Catherine. Hello, everyone. Welcome. We're just waiting for people to join.
Go in if you wanted me to do that. Oh, I think I can do that already.
Oh, good. Yeah, just ASU just required we have waiting rooms now for security purposes. Hello to those who just joined. We're just going to wait a few more minutes to give people some more time to join. I think Randy is a little bit behind as well. She might be in clinic, so just a few more minutes. Oh, thank you, Catherine, for allowing renaming. Yeah, if any of you want to change your name, you can do it. You don't even need a lawyer here. You can change it in Zoom. Hi, everyone. Welcome. It's 2 minutes after the hour, so we'll get started with introductions, and then as new people come in, we can just let them introduce themselves. Let's see. Yeah, if you have a camera, you're welcome to turn on your camera. We'd love to see your face, but if not, I totally understand. Also, if your audio is on, we just ask that you keep your microphone turned off until you're ready to talk, or if you have a question. So I'll start with introductions, and then I'll go to Catherine, and then we'll just go around the virtual room so people can introduce themselves. So my name is Matt Martin. I'm a licensed marriage and family therapist. I work here at Arizona State University. I have, before coming to ASU, I worked in behavioral medicine education for about 10 years. And I've been working with Randy on developing this addiction medicine curriculum for a couple of years now. So I'll be helping her to implement and evaluate the curriculum during this pilot. So we're really excited to have all of you help us figure out if this is going to be a good thing for residents. So let me turn it over to Catherine, if you want to introduce yourself.
Everyone, I'm Catherine. I'm a junior at Tufts University, and I'm helping out as a research coordinator. Basically, that just means I'm sending out all the emails to you, so now you know that it's from me. So do you want to kind of just go in order, Matt, of the people that you see on your list?
Sure, that sounds good. So we're going to do introductions. Just tell us who you are, where you're located, and anything else that you'd like for us to know. So I'm looking at my screen. Let's start with Christian Very. If you want to go ahead.
Yeah, hi, my name's Christian Very. I'm a physician, a faculty with Mercy Family Medicine residency in St. Louis. So I'm participating with, Dr. Sarah Cole and I are kind of splitting responsibilities as far as helping to implement or participate in the program and then try to implement it into our residency practice. I also do some work. I'm a medical director at a local substance abuse program here in St. Louis. So I have particular interest in the topic.
Excellent. Thank you, Christian. Welcome. Let's go to Lonnie J. I hope I pronounced your name right.
Yeah, you did. My name's Lonnie. I'm a physician. I live just outside of Sacramento, California. My training is in family medicine and addiction medicine. I have been working at an addiction medicine, a MAT clinic, as well as a medical director at an inpatient rehab. But I am just about to start in 2 weeks with the Sutter residency programs. We'll be faculty with the residency program. So the Sutter location is in Sacramento, and then I'll be with the rural track of that program.
Wonderful. Thank you, Lonnie. Welcome.
Thank you.
Let's go to Adriana Linares.
Hello, this is Adriana Linares. I work in Vancouver, Washington, and I am a family medicine faculty at 888 residency program in Vancouver. We are 8 minutes from Portland, Oregon.
Very close. Nice. Thank you, Adriana. Welcome. Let's go to Charles Peterson.
I'm a residency faculty member here at Adventist Health Glendale. This is located in the LA area, Southern California. I'm the assistant program director as well as the addiction medicine curriculum coordinator. I also run our addiction residency program rehab center that's affiliated with our hospital. And I just recently took my boards for addiction last month. So, fingers crossed that we passed that one.
Hey, great timing. Good luck on that.
Thank you.
Welcome, Charles. Okay, let's go to Melissa Arthur. Welcome, Melissa.
Hi, I'm Melissa Arthur. I'm the Director of Behavioral Science for the St. Joe's Family Medicine Residency in Syracuse, New York, and I'm going to be co-leading with Dr. Elizabeth McNanny, who is not quite here yet, I don't think. So we're very excited. We've slowly started a Suboxone clinic in our Family Medicine Center, and we've been wanting to increase our educational opportunities around addiction, so we're very happy to be here.
Great. Thanks, Melissa. Let's go to Judy.
Hi, I'm Judy. I do have a last name. It's Judy Gravdahl, but I just was feeling informal today. I'm faculty at Advocate Lutheran General Family Medicine Residency Program in Park Ridge, Illinois, just right next to O'Hare. And we had for many, many years had the luxury of having a full addiction team and service and actually a required rotation. And then we lost the last remaining addiction specialist. So this program came around right in time so we can figure out how to make it even better with a longitudinal approach to addiction.
Wonderful. Welcome. Thanks, Judy. Let's go to Liana Milanes.
Yeah, hi, I'm Liana. I'm just been faculty for a couple of years at a program here in Fresno, California, which is in the Central Valley. Very much an area of growth for me and for the program. I just finished the ASAM Fundamentals of Addiction Medicine, so my knowledge is theoretical and hoping to get up the actual practical part of it. So limited, but an area of growth.
Welcome. Thank you, Liana. Let's go to Elena Klein.
Hi there. I'm Elena. I'm the clinical pharmacist on faculty at the Beaumont Family Medicine Center residency program in Southeast Michigan. I'm serving as the program director for our substance use disorder clinic. And myself and our addiction specialist actually started our clinic from the ground up. So it's the first one within our health system, and we're looking to expand internally and then also throughout the health system. We were also looking to roll out an SUD curriculum starting next year. So this actually just came at the perfect time. And we've also got on the line Mark Lausch, who's our clinical social worker, who is going to be helping us run the SBIRT model as well. So thank you.
Great. Wonderful to have a pharmacist. Thanks, Elena.
Thank you.
Let's go to Beth Bachhold.
Hi, I'm Beth Bachhold. I'm one of the associate program directors at Hinsdale Family Medicine Residency Program, which is an Adventist program actually as well. We're in Hinsdale, Illinois, which is a western suburb of Chicago. So we currently do have, our residents do work with an addiction medicine doctors inpatient, but we never really had a formal curriculum. So that's definitely something we've been trying to get going. All the faculty, we do not have a clinic yet, but all the faculty are working on getting their X license and things like that. So we're really trying to do more and more of that at our program going forward as well. So, and I work with Tony Atkin, who's our behavioral scientist, who's also on the call.
Great, thank you, Beth. Okay, next, let's go to Eric Carpio.
Hey, how's it going? I'm Eric. I'm a third-year family medicine resident with the Sutter Family Medicine Program in Sacramento. So same with Lonnie here, is going to be on faculty soon. And I have an interest in addiction medicine, and I've been finding myself this last year actually been prescribing more Suboxone to some of my patients, which has been a rewarding experience. So I'm just excited to learn more about this curriculum.
Very cool to have a resident. Thanks, Eric.
Yeah.
Let's go to Claire Eberhardt.
Hi, I'm Claire Eberhardt. I'm at the University of Maryland Family Medicine practice in Baltimore City. I'm a clinical social worker and part of our residency faculty here. So we're excited. I'll be doing this along with Dr. Silva, who is on her way, I think, to join us, hopefully. And we're excited to kind of have a more concrete substance use curriculum for our residents. It's something that we certainly see a lot in our patient population, and the residents have been asking for some more specific curriculum. So we're looking forward to getting started.
Wonderful. Thank you, Claire. Let's go to Matt Kelly next.
Hello, everybody. Matt Kelly, I'm faculty at the Lewis Gale Family Medicine Residency Program in Roanoke, Virginia. We've been looking to expand and improve our didactic curriculum, and this came out at a great time for our program. So, nice meeting everybody.
Great. Thanks, Matt. Welcome. Let's go to Clara Rosenzweig-Vecino.
Hi, I'm Clara Rosenzweig. I'm behavioral health faculty for Methodist in Houston Family Medicine. I'm here with supporting Dr. Sharon Anderson, and happy to be here and happy to learn and grow.
Thank you, Clara. Welcome. Okay, next is Liz Kabach.
Hi, I'm Liz Kabacha. My pronouns are she, her, hers, and I am on faculty with the University of Colorado Family Medicine Residency Program and based at Denver Health, the county safety net system in Denver. We have an MAT clinic that we've had for several years that multiple faculty help staff, and also have our family medicine residents rotate through it, but also have internal medicine residents and med students. So I think also looking for curricular suggestions for multiple different levels and types of learners.
Very interesting, Liz. Yeah, very cool. I'll be interested to hear your thoughts about the multiple disciplines. Thank you. Welcome. Okay, next, let's go to, it looks like a username, RFO6153.
Sorry about that. I'm Dr. Hillary Linderman. I'm a clinical health psychologist, and I work with Dr. Kelly at Lewis Gale Medical Center in Roanoke, Virginia. Thank you.
Thank you. And your name was it Hillary?
That's correct. Linderman. Yep.
Hillary. Okay. Hillary, welcome. Thanks. All right, let's go next to LaDonna Porter.
afternoon. Happy New Year, everyone. I'm LaDonna Porter. I am the program director for St. Joseph's Medical Center Family Medicine Residency Program, Dignity Health in Stockton, California. I have been teaching and practicing addiction medicine for about 21 years. So I'm really excited because we're a relatively new program. We have an addiction medicine rotation in our PGY3 year, and this curriculum could not have come at a better time.
Wonderful. Great timing. Thank you, LaDonna.
Thank you.
Let's go to Timothy Pelkowski.
I'm the Associate Program Director for Residency in Erie, Pennsylvania. We've really had no experience with MAT. We've got a couple faculty now who have their DEA waiver, and of course, this is going to be great timing, as so many others have echoed, to help get us going from MAT in particular. So we're very excited to be on board for this.
Perfect. Welcome, Timothy. Let's go to next is Sharon Anderson.
Hi, everyone. I'm Sharon Anderson, Associate Program Director here at Houston Methodist Family Medicine. I work with Clara. We, as many of you, are also looking to bolster our addiction medicine curriculum. We don't have any faculty who are addiction medicine boarded, and this came along at a good time. We were looking to develop this experience for our residents. Happy to be here.
Thanks, Sharon. Welcome. Okay, next is Samantha Kettle.
Hey, I'm Sam, and I'm at Sutter with Lonnie and Eric in Sacramento, Davis, and Amador, and we have a hodgepodge of things that kind of get thrown in throughout the 3 years, and so it'll be nice to have a little more focused structure to our approach. So thank you.
Structure is good. Welcome, Sam. Thanks. Okay, next is Mark Lausch.
Hey everyone, my name is Mark Lausch. I work with Dr. Klein at the Family Medicine at Beaumont Health Family Medicine Center, Sterling Heights. I'm a clinical social worker and a certified addiction counselor working with our MAT population. And I've been doing this for about 30 years. So I enjoy what I do, and happy to be a part of the MAT program SUD clinic at Beaumont. Thanks.
Welcome, Mark. Glad to have you
Thanks.
here. Let's next go to, I see another username, JAA264.
I'm sorry. I'm also at Hinsdale Family Medicine Center, the Adventist, with Beth Bachhold. I'm the Director of Behavioral Science, and we do have some addiction doctors in the inpatient, and we're just trying to beef out our outpatient program and education. So very much looking forward to being part of this.
Great. Thank you. Welcome. Next is another username, DC Weimerman. D. Simerman.
Hi, I don't know if you can hear me. I'm Dawn Zimmerman. I'm also from St. Joseph's in Syracuse, New York, with Melissa Arthur. So she kind of explained our program, but we're looking forward to this.
Okay, great. Welcome, Don. Thank you. Okay, let's next go to Luz Fernandez.
Hi, I'm Luz Fernandez. I'm the current program director for the University of Louisville Family Medicine program, and we do not currently have an addiction medicine curriculum, and so this came at a really good time when we were thinking of trying to build one. So we're hoping to use what we get here and then kind of craft it to suit our particular needs.
Perfect. Welcome, Luz. Let's go to Julia Silva.
Hi, I'm Julia Silva. I'm from the University of Maryland program. I work with Claire Eberhardt, who you met earlier. And I did a lot of addiction medicine in residency, but as a new faculty, had no idea where to start with an addiction medicine curriculum. So I was really excited that this opportunity came along to bring more addiction training to our residents.
Perfect. Great timing. Welcome, Julia. Let's go to Gaurav Zirath.
Hi, good afternoon, everybody. My name is Gaurav Zirath. I'm one of the faculty members here at the Valley Health System Family Medicine program in Las Vegas, Nevada. We are a brand new program. We have over two set of classes here. We interviewed for our third class to join us in July of this year. So we're a brand new program. We were working on starting an addiction medicine curriculum. So this came at a right time. We currently don't have any addiction medicine experience for our residents, and there's certainly a lot of need for addiction medicine in Las Vegas for understandable reasons. And this program will certainly be a huge educational value to the residents.
Great. Always exciting to hear about new programs popping up. Welcome, Gaurav.
Thank you.
Next is Daniel Yoder.
Yeah, I'm coming from Hendersonville Family Medicine Residency. Amber Henson is our faculty that's kind of leading the curriculum here. So I'm just chiming in for the SBIRT session. I'm a relatively new faculty here. Had been working in East Tennessee prior to being here. I don't have any experience with MAT, but did a lot of work with bringing SBIRT into our community health center where I was before. So I'm excited to join the session.
Great. Thank you, Daniel. Welcome. Next is Denny Peterson.
Hi, I'm Denny. I'm from St. Cloud, Minnesota. I'm one of the associate faculty for the University of Minnesota St. Cloud program, affiliated with CenterCare as an organization. I am also going to be presenting the SBIRT session, so I'm excited to be here. Thanks.
Great. Welcome, Denny. Thank you. Next is Betty.
I haven't quite figured out how to change that screen name yet. Sorry, I'm a little behind. My name's Betsy McNanny, and I work with Melissa Arthur, who's here and part of the Syracuse program. And she probably told you, but you guys are coming at just a good time for our program, so we're grateful.
Okay, thank you, Betsy. Welcome. Let's see, just a few more left. Steelman.
Hi, I'm Michael Steelman, Program Director in Lidditz, Pennsylvania, the UPMC facility. We have a fairly established program, but excited to see what you're able to bring forward in a more developed curriculum, and your interactive sites are actually pretty enticing. So just to bring something new to our program.
Wonderful. Thank you, Michael. Welcome. Next is Barb Nightingale.
Hi, I'm Barb. I'm at University of Pittsburgh Medical Center, UPMC in McKeesport, and we have an MAT clinic, and we are doing some addiction curriculum, but like other folks have said, it's sort of haphazard. So we just wanted to have something more formalized in addition to the waiver training that the interns get. So I'm really excited about this.
Great. Welcome, Barb. Thank you. And next is TJS. Looks like you're on your iPhone. Are you able to hear us? It looks like some initials, TJS.
I'm going to speak for, that's Tom Satry. He's the director of our program in St. Cloud, and I think he's precepting and listening in. So thank you.
Okay. Welcome, Tom. You're multitasking. Glad to have you here. Okay. I don't think I missed anyone, so I'm going to turn it over to Randy. Randy, if you want to introduce yourself, and then we can get going.
Can you hear me? Yes. Great. I am so sorry. I've been planning for this meeting for like 2 months, and I had a Suboxone intake that was probably my most complicated ever, and I had to like run back from clinic. Anyway, it was quite an interesting afternoon. I'm so happy to have everybody here. And it's so exciting to see this come to fruition. We have, Matt, have you introduced yourself? And Catherine, have you introduced yourself? Great, okay. So what I wanted to do, I can give you the outline for the next 35 minutes that we have together, is I'm going to just kind of give you an overview of the curriculum, just so we're all up to the same speed. I know some people who are on this call were on our previous call, so I'm not going to rehash everything. But we're also going to take you through briefly through the website so you know how to access the resources, and yeah, you can, you basically are able to move forward here and you know what you're doing. And then Catherine is also going to talk to you guys about how to get this stuff out to your residents and some of the teacher's guide stuff. And then so after we kind of talk to you, we're going to actually talk about the SBIRT module. So just to kind of give you guys a sense of what's happening here is every month, so we have 12 modules, basically. One module is happening a month. Some of you guys are going to be involved in every one, I would imagine. And some of you might be only involved in this SBIRT one, and then somebody else is going to jump in next month to do addiction as a chronic disease, and then somebody else might jump in next month. So you're probably going to do things very differently based on where you're coming from, and that's totally, totally fine. We're just glad that you're here to participate, and we want to make sure that you feel prepared going forward, and you know what the expectations are. So we are really envisioning this time, this monthly time, as what we're calling, a community. Matt, what's the term you use? Because I always mess this word up.
A community of learning.
Community of learning. I always say faculty development. But, this is an opportunity for us. I mean, there's clearly people here with various levels of addiction training and various levels of teaching experiences, but we want all people to be able to come together and feel like we can learn from each other, think about how people are teaching things, thinking about how people are thinking about addiction. And this is a great way for us to serve as an addiction community to each other. So that's why there's things built on the website, like a listserv, like a resources folder where we can share things with each other. And it's meant to grow us as faculty just as much as it's meant to grow the residents. So I just wanted to kind of frame that for you guys. So how does this work? Basically 12 modules, 12 months, 1 module per month. And the way it looks is each module, as you saw from the SBIRT, has about an hour to an hour and a half of online content that the residents complete beforehand. And then that is followed by an interactive session with one of the faculty members, such as yourself, for an hour. Yes, it's like an hour of an in-person session that's meant to be highly interactive and case-based and application-based. So we're really taking a flipped classroom approach with this, where the residents complete the module and they come in, and then we do activities with them. And all of the activities that we're going to be doing, that you guys are going to be leading, are already created, and you're just going to be implementing them. They are all tweakable. You can change them however you want based on your own level of expertise and experience, but we are trying to provide you with a template so that you can literally walk in there and not have to develop anything. Few other important points is that again, we're leaving this up to you to figure out how you want to implement it in your residency program, what learners you want to choose, whether you want to do R1s, R2s, R3s, combine them together, whatever the schedule is. We highly encourage you to let the residents have dedicated time to do that 1.5 hour of online module. It's really hard to ask busy residents to do this outside of their protected time and expect that they're going to do it and be ready coming in to the session with you. So they do need to do that module before coming with you, or it's going to be hard for them to get much out of it. So that's kind of the way it works. We've talked a little bit in the past about how do we hold residents accountable for doing the modules. And again, if they don't do it, they don't do it. They're adult learners. We're trying to go in with the mentality that we encourage them to do it and we want them to do it. However, we have built into all the modules and now a completion certificate, so that once they complete all the modules and they get to the end, they'll enter their name in, and it will produce a little certificate that says that they did the module. They can take a picture and send it to you if that is something that you want to hold them accountable for. Again, not mandatory. All we're asking is that the residents do the module, meet with you, and we get feedback. So the way this is working, and for each month, is we use the first hour, except for this month, to look to, we invite all the faculty who were involved in teaching last month, and we're going to talk about how it went. So it's a way for us to say, to like just kind of debrief after the session, get learning points, what worked, what didn't work. So it's a good opportunity to grow in our teaching skills, but it's also an opportunity for you to give us feedback about the teacher's guide and about the module. So basically this time next month in February, you guys are all going to come back the first Tuesday of the month. We're going to spend that first hour and we're going to debrief how it went. And then you're done. Okay. The second hour of this part is what we're going to do today, which is preparing the people who are going to deliver next month's content. So today we're going to talk about SBIRT and we're going to hopefully get you geared up. So that's kind of the way this is structured. We dedicated the first Tuesday of every month for faculty. Those who just taught are going to come in and share what worked, what didn't, revisions. And the second half, if you're involved in that, you will be preparing for the next month's session. So I'm going to stop talking because we got a lot to get through. I'm going to turn it over to Matt, and we will take questions. I just want to kind of go over everything with you guys so you can hear it, and then we'll take questions from the group towards the end. But Matt is going to walk us through very briefly the website. Matt, we don't need to go through it obviously in super detail, but mostly orienting them to the important stuff they need to know.
Okay, great. Thanks, Randy. I just put a link in the Zoom chat if you want to look at the website. I did go over it before, like Randy mentioned, so I'm not going to talk too much about it. I'm going to share my screen and we'll walk through this together. Okay, so this is a Google site. So you'll want to make sure that you're able to access it using your work servers. I know that some servers have a firewall that does not allow for Google products to be used. So make sure that you have access to it. This is a nice central location for just a lot of the information and resources that we have for this curriculum. So on the landing page, there's a video with Randy just talking about an overview of the program. There's another video that just gives you an overview of the website. And then you can see the schedule for our monthly meetings right here. So next month in February, we're going to be reviewing the module called Addiction as a Chronic Disease, and that's going to be on February 2nd. So that's the first page. Then if you go to the next tab, this has links to all of the teacher guides. So these are the documents that you'll be using for the in-person resident training. So this has the cases, the handouts. You just click on this link and it's going to take you to a Google folder. Now, I know that some of you are not able to access that because of that firewall. So what we're gonna do instead is we're going to put those files into another location, probably Dropbox, and give you access to that. So those are all the links for all 12 modules. And then this goes into the third tab has a link for registration. So the residents will have to register first before accessing the modules. And then we've been approved to offer CME credit to anyone, maybe faculty, other instructors that would like the credit. That's still being worked on at this time, but it's something we should be able to offer in the near future. The next tab shows meetings. We're going to use the same Zoom link for all of the monthly meetings. So the link that you use today, it's going to be the same one for February. This tab just has a calendar and information about each of the meetings. The next tab has a directory of all the pilot sites. So if you want to learn more about who's participating in this pilot, you can just look at the directory. You can also look at this map as well. We also have an email address that you can use if you want to send a message out to the entire group. Maybe you have a question about how people at other programs are protecting resident time to complete the module, so you could send that question out. You just have to use this email address to send out questions. We're also going to be uploading the recordings for all of these meetings right here underneath at the bottom. So if you're not able to if maybe you're not able to attend in the future, a recording of that meeting will be available on the website. And then this page has some resources, including some FAQs, as well as an email template in case you need some language that you want to send out in an email message to your residents. And then we're hoping that some of you might be interested in sharing some resources that you have for this curriculum. Maybe you've developed new handouts or new slides or other cases that you'd like to share with the rest of the group. We're going to put all of those into a shared folder. And then the last tab just has contact information about the three of us, Randy, me, and Catherine. Okay, that's a very brief overview of the website. Any questions about it? Okay.
How do you access it again?
I'll put the link again. I'll put the link in the Zoom chat, so it should pop up on your screen. Did you see it pop up? Okay, great. Okay, Randy, back to you.
Thank you. Okay, so I was going to pass it off actually to Catherine. So I mean, I think Matt, you talked about how to access the modules on the teacher's guide. So maybe Catherine, can you review that one more time, and also how to send out the link to residents so they can get enrolled in the course? Can we just, those are the next steps that everybody has to do. So I want to make sure it's 100% clear what your next steps are. And also your point of contact for questions related to this stuff is Catherine. So Catherine, are you able to?
Yep, I can share my screen to the Canvas site. So to send out the registration link, you can find it on the website like Matt mentioned. I think it's somewhere on the modules tab. Yep, there's a registration link here, or you can go to the Canvas site, which I think you're all registered in. And the link is right here that you can copy and paste this link and send it out to your residents. And with this link, they just need to sign up once and they'll have access to all the modules for the rest of the year. And I think many of you might have already, looked around on this website, but to access the modules, you can click on that tab. And here you'll see SBIRT for January, and you can walk through all of these and see the modules, the teacher guides. Yeah, all the handouts are linked onto here. And basically this is the tab where every module is going to be. I think that's it. I'm not sure there's anything else.
Yeah, that's great. So just to let you guys know, on our Canvas site is the teacher's guides. Obviously your residents don't have access to that. So we've kind of made that something that only you have access to. Just as that outline showed, I just wanted to make sure that you guys are aware that all the residents are going to complete a pre-test quiz. It's usually 8 to 15 questions. Then they're going to complete the interactive, which is the actual module that takes an hour to an hour and a half to complete. Then they take a post-test, which is, kind of assessing their knowledge afterwards. This is not a rigorous thing. We're not asking them like a month or, a few months out if they remember any. It's just really pre and post if any learning took place. And they're also going to complete a very brief 4-question survey that asks them about the content and the format of the modules. So we're going to be collecting that with every single module. I definitely want to save time to talk about SBIRT, but let's just pause for a few minutes and see, does anybody have questions about accessing any of the information for yourself, for the teacher's guide, or for your residents, i.e. they need the link to the modules and they need to register and they actually need the link to the module. Any questions about how to access any of that?
So this is Christian Berry in St. Louis. Quick question: when the residents are registering, So we registered as teachers, if I remember correctly. Do they register under a different moniker so that they don't have access to that teacher's guide? Do they go under a different title? Is there like a learner's title or something?
That's correct. Yeah, they have a different privileged status. So they'll be identified as student only in the system.
Okay, very good. Thank you.
Any other questions? Let's see, Denny, it looks like, are you talking? Oh, you're muted right now.
That was a lot of work. All I was going to do was going to congratulate Catherine on doing such a great job yesterday. We had all of our residents take a noon break to just do their modules yesterday because we were concerned about the accountability, and it worked wonderful. They were able to do it over their noon hour, and they were all able to fax the certificates to us or email them or send them by mail. So it worked great. Thanks.
Awesome. I love hearing positive news. This is very exciting. Okay, so, and I also want to reiterate, I said this on the last call, but this is a pilot and we are bound to run into stuff that happens. So to hear positive feedback already is wonderful. But we definitely, one of the reasons we're doing this is to collect information from you guys about what's working and what's not. So please be forthright in sharing all that information. Okay, I think what we're going to do is we're going to spend at least we're going to delve into SBIRT now. Hopefully everybody on this call was able to access and view the module. If not, that's totally fine. Please do it because you're going to need to know what the residents just completed. And we also are going to want to hear from you what you thought of it. Please make sure you go through the module before you teach the session. As far as the teacher's guide, hopefully you've all been able to look at that, at least skim over it briefly. So what I was going to do, I know you guys can read, but I was just going to give you an overview of what the teacher's guide looks like, what is involved, and then open it up to feedback in terms of what do you think? Do you have anything to share with other people? First of all, do you have any questions? And do you have anything to share with other people about how you might go about implementing this? Again, we want to empower you guys to use this guide, this teacher's guide, exactly as is, or you can modify it however you want. The goal is to have residents be competent in SBIRT. So we try to make it so that you don't have to do anything if you don't want to, or you can, change things up and do it based on your culture, your way of teaching, all that stuff. So basically, this is an hour-long session. And, we usually encourage people, at least what I do with my residents is whenever they complete the online module, I'll usually spend the first 5 to 10 minutes getting them to share anything you learned about this. What did you, tell me 1 to 2 things that is new to you or that you're going to do differently. And this gets them kind of, it also shows you that they're thinking about things. You can kind of get a sense of where they're at. It gets them engaged early on. So that's how I usually spend the first, 5 to 10 minutes of warming people up and getting a sense of what they thought and where they're at. And then we actually do some activities. So in terms of this session, I think it'll be really important just to kind of lay down some clarifying parts to this. So, you can explain to them what, well, first of all, you can answer any questions they have. And then you can explain that over the next hour, you're going to be doing some cases. The first one is a fishbowl case where everybody's watching in. And then the second 2 are them breaking off in pairs. One person's a doctor, one person's the patient, and they flip. We put down some rules here that might be helpful. And that is that although we're going to be spending a lot of time when we're playing patients and doctors of doing motivational interviewing skills, that's not what this is about. This is not just about practicing motivational interviewing skills. What we're really trying to do is have our residents make sure that they are screening, selecting an appropriate tool and practice giving it. After they give it, they give feedback to that patient about what the results were. Then they employ their motivational interviewing skills to help the patient get to where they need to be in their next steps, and referring them to some treatment. Now there's going to be a lot of subsequent modules that talk about levels of care, whether it's getting somebody to inpatient or to an intensive outpatient program. Again, that's not what the point of this is. They don't need to know all that stuff now. They need to really focus in on how to do a screening, how to give the patient feedback, and then taking some next steps along motivational interviewing principles, or how to give the patient feedback about what the results are and what they're going to do after that. So the way this is designed is that there is a fishbowl case. The case is already laid out. So you should have the overall guide that tells you what to do. And then you should have the other ones are the cases. So there's a fishbowl case and there's 2 other cases. So the residents are all going to need access to that. We can talk about what this looks like in a virtual platform as well. Now you can do the fishbowl case however you want. I've done, and I'm going to open it up to what people like. But I've tried 2 different strategies. One is having a resident be a doctor and a resident be a patient, and then and kind of letting them in front of everybody play out the scenario and let it happen, and then people give feedback afterwards. Or you can have people jump in, kind of like tag team doctor. Okay, well, maybe this is how we can modify things. Or sometimes I'll do timeouts and say, okay, what's working well, what's not working well here? Okay, resident doctor, how do you want to modify things? Another strategy I've tried in the past is actually I'm the patient and I allow the residents to be a collective doctor and do SBIRT with me. So those are kind of a few different models you can use. And then after you kind of do some debriefing about what's working, what's not, kind of go over some of the learning points, then you can have them break off and do the 2 cases. It's designed so that there is 10 minutes of doing SBIRT and with patient, doctor, patient, resident, patient, resident, doctor. And then the patient gives that doctor feedback for 5 minutes, and then they flip and they do the same thing. And then we'd like to bring people back in as a large group at the end, and then again debrief. What did you learn from this experience? What worked well? Give us some specific examples. Why was your doctor good at doing SBIRT or helping you with next steps? What might we do differently moving forward? What questions do you have? So that's kind of the framing of the session. And again, it's meant to be an hour long, starting with some reflection, starting with some questions, figure out what they learned, laying out the ground rules, what we're trying to accomplish, and then doing a fishbowl case for a good 20 minutes, and then doing 15 minutes of small group, and then coming back to debrief and create learning points for folks. So I'm going to stop there. And I'm going to open it up to questions, comments, or thoughts about how you might do this, or how you might tweak it as a way to learn from each other.
I would love to hear how you've imagined doing this in a virtual environment. I mean, I've been thinking about like breakout rooms and those sorts of things on Zoom, but if you have any experience with how you've done this in a virtual environment, that'd be great.
I'm happy to chime in on that, but I also don't want to be the only one talking about this stuff. Has anybody using the virtual format done the small group, the pairs really well? And what did you do?
For me, this is Adriana Linares. I have tried to do that, and one of the main problems has been getting both of them to talk on these groups. So we work with Teams, and Teams hasn't been that easy to create the divided groups. So I did that last week, and we had a little difficulty. So at the end, what we needed to do was just what you just mentioned, me being the patient and them being the doctors, because we couldn't do the two groups, the two people group, due to problems with technology.
Has anybody had success with technology?
So depending on the platform you're using, we use WebEx for our didactics virtually, and we are able to split residents into separate groups for a certain amount of time. I believe Zoom lets you do that as well. So we have assigned timeframes. Let's say we split certain residents in their own separate rooms for 10 minutes, and after 10 minutes are up, everybody automatically gets brought back together as a large group. Again, I don't know what everyone uses, but WebEx and Zoom certainly allows you to do that. We've had great success with that. Once you're when the residents are in their own individual groups, they stay there. They don't get interrupted by anybody. But as a facilitator, you do have access to all of these individual groups, so you can chime in to make sure how each individual groups are doing, if they have any questions, etc. So we've had great success with that.
So you're using breakout rooms, basically.
Correct.
Anybody else?
I have a question, but not a comment. So has anybody done that successfully on Teams? We can use WebEx. We more commonly use Teams. Certainly, though, if Teams isn't, it sounds like Teams may not be an option here from what I just heard, but that WebEx would be the better option.
We use Zoom. All of our interviews, this is LaDonna Porter. All of our interviews, of course, are virtual for this interview season. And the way our interviews are structured, we have to be either pulled into breakout rooms, or we have to go to a breakout room. And after our initial slight trial and error, we've been able to do that successfully. And that's on Zoom though.
Microsoft Teams, just to comment on that, does allow you to have breakout rooms.
So I will say another backup strategy that I use, because I'm really not good when it comes to technology. There's breakout rooms, but I also sometimes, while the very beginning, say we're going to do a lot of group work, I want you to choose a partner right now and call that person, and they will do, then they'll do like, what do you call it? Where you can see the person on your phone, FaceTime, or they'll just call them and do it that way. But I think most platforms do allow for breakout rooms. Even Google Meets has breakout rooms. So I think figuring, experimenting with that before you go in to teach. And then if it doesn't work out, you can just assign people, you call this person, you call this person. We have color teams at our clinic. So I basically put, that means that like we have a red team, blue team, yellow team, green team that we see patients in. So the yellow team residents partner up the blue team anyway, etc.
My name's Judy. I'm a computer phobe. And I think, it's worked well when we've had a resident who can do the technology. And I can one-on-one with one of our technological residents, but I worry about what might be missed by not being able to kind of see what's happening in the dyads. We've done breakouts where we've gone into small groups, but not dyads. And I didn't know you could kind of be available to kind of watch and see what's going on. So I'm looking forward to learning that part of the virtual and flipped classroom, but I'm bringing my concerns to it.
Yeah. And so again, another strategy we could try is to keep the whole room there and do fishbowl with it the whole time. People get a lot out of that, whether you're playing the patient or you have somebody else playing the patient, and you periodically stop and get other residents to say, okay, what would you do now? What would you do now? Let's think about this. And the residents actually say they really enjoy that because they get to hear how other people counsel patients or approach things, and they learn from each other.
That approach might be challenging with time, though, I would imagine. If you're doing paired groups, you're not going to be able to get, you have to limit the number of residents that would then do that in a fishbowl manner.
Definitely. And I also want you guys to feel like, you do not have to follow this. If you go through one case in a lot of depth and there's a lot of learning that takes place, or two, that's the point. This is not a rigid, I have to get through 3 cases. It's more about, am I making sure that they're learning and there's value here? And this is going to probably require some experimentation, and that's why we're going to continue to do this and refine it. So it'll be interesting to see what people say next month. What other thoughts do you have? Edits, thoughts about this overall session or the module that you viewed, or questions for the group?
I know I was going to bring it up in this particular, like even the fishbowl example, you going through it and after you going through the module, even though a lot of this information is old and we've been using it because it's tried and true, is there are still things you can ask, like, what about this statement, like in any normal STEM, what about this statement stands out to you? Why is this important? Why is this information given to you in the STEM? Is it helping you make a decision one way or the other? Like, is there a risk factor in there? Is the fact that the patient has a mental health disorder contributory? Is the fact that there was childhood abuse contributory? When it comes to like no smoking and the no illicit drug use, I know I'm in California, so whenever we say no illicit drug use, people don't know if you're including marijuana. But the old criteria, they didn't include marijuana. When you say no smoking, do you mean no vaping, or do you mean no smoking or vaping, or all the above? Is we find that we have to kind of modify that because people don't identify vaping as smoking, especially our younger adolescent kids. So even though it's not part of the module, there's a lot of stuff you can pick out from the STEM in itself to help use an educational point. So that's something I noticed even after completing the SBIRT module. There is no commentary about asking specifically about marijuana or vaping versus smoking. But again, I want to highlight both of those points, that there's extra information not in the module, but there's also a lot of stuff in the STEM that you can pull out just to be educational. That's above and beyond the SBIRT portion.
Can you clarify what you mean by STEM?
There's the case, the actual case, reading the case. I always say STEM because it's what we use when we're reading board questions, but the case in itself has lots of information that you have to determine whether or not it's useful for answering the questions, or whether it's just there because it's giving a complete history.
So those are some great ideas to introduce. Does anybody have other ideas based on your experience doing SBIRT or questions you have? We have over 25 people here with various experiences doing SBIRT. So I'm sure people have some rich ideas to share or questions to ask.
Adriana again from Vancouver. We have different people in our residency program from different backgrounds and speak different languages. So I found that I didn't see too much about that cultural part of the SBIRT. So I don't know if you had this translated, or you have used it at least in Spanish or Vietnamese or Russian, which are the ones that we use here.
Yeah, I don't, that's a really good point. I think for the purposes of residence learning, hopefully, you know, they'll be able to complete the modules and the activity in English. But when it comes to your clinic, I think you're probably going to have to find those resources based on your patient population. I mean, I think for a lot of the stuff like audit and DAS-10, I would imagine they're available in most languages. I haven't searched that, but they're such common best practice tools that you might need to search that when you're actually doing patient care. That makes sense. I think it's a good point to, we can't use the same standard forms for all of our patients for sure.
Another comment I have too for this, I know it's probably going to come up later in the taking a history. This is a pretty, I think good overall history, but again, taking a substance abuse history, I always ask the residents, what else could we have asked that's missing? Have you only done AA meetings? Have you ever had a sponsor? Did you like the AA meetings reason or structure? Is that why you continue to go, or did you not like it? Have you ever tried something like the SMART recovery programs? Have you ever tried any medications? Maybe list the MAT meds in the past. Did they work or not work? Did you stop them? Why did you not stop them? Just some other things to kind of fill in some of the gaps, because it might help you with, I think, what your treatment plan might be.
Yeah. Yeah, it's going to be rough when we're building on things. There's only so much we can include in this module.
Yeah.
But and right, the history taking is going to come in. That will definitely be part of their learning, just not built into this module. But you can, definitely share that stuff with them. Okay, I'm mindful of time. It's 4 o'clock. I would encourage people, if you have questions, please use the listserv. I think it would be so great to really start that now and get used to using it as a way to share questions, to share ideas. And if you have any resources, or you look at, you go through the case and like, why don't I just modify this way? And then you can drop it into the folder. This is going to be such a great way for us to learn from each other. I want to make sure everybody is aware of next steps. So we are meeting on the 2nd of February, same time, and we're going to be recapping what the experience was like from 3 to 4. If you are teaching the next module, what is the next module? Somebody help me out. Let's see.
I think it's the addiction as a chronic.
That's right, as a chronic disease.
So if you're teaching addiction as a chronic disease, then you will be on from 4 to 5 Eastern Standard Time, the second half of that hour, to prepare for that. So again, everybody here should be on the first hour to reflect on what happened and learn from each other. And the second hour, if you're teaching the next module. The other to-dos for you are to make sure you have done the module, you have access to the teacher's guide, you send out the registration link to your residents, and you make sure that you have hopefully allocated time for them to take it. And if you have any questions, logistical things, please email Catherine, and we'll go from there. Any last minute thoughts or questions? Okay, I'm just going to leave it for 1 more minute. I'm looking at the clock here. Give me some feedback, if you have any, about this meeting and if it was helpful or not, or things we should do differently next month.
Randy, it's LaDonna Porter. What was really helpful was, again, hearing how you approach the modules and how you approach having the residents complete their modules, and how we should approach as instructors. I have a fairly moderate number of, I have residents, I have faculty, I have students. I also have transitional year residents as well, who attend our didactics, which is on Thursdays. And so this was really helpful for me to think about how to integrate this particular curriculum within our didactic curriculum. So thank you. That really helps me.
Thank you. Thank you for the feedback. I'm also looking that we should not spend so much time on introductions. That's totally fine. I don't think we need to keep doing that. It's probably going to end up being a lot of the same people over. We might get new people, but we can just delve into the content.
Would it be helpful to just have the new people introduce themselves?
Great.
Since the rest of us are actually probably going to be here, that would help.
That's a great idea. We're not going to have to keep going through the website every time probably and all this other stuff. So hopefully it'll start becoming, we know what we're doing. We're going to actually talk more about content. Any other feedback? You can put it in the chat too.
I just thought it was really great how clear you are with the next steps. And I think it's a good parallel for us to do with the residents.
Thank you. Okay, so again, questions, comments, put them in the chat. Contact Catherine and try to use the listserv, try to use the resources. Hope this month goes great and we'll hear about it next month on the 2nd. Thank you, everybody.
Thank you.
Thank you.
Thank you.
Thank you. Randy and Catherine, do you want to stay on?
Sure.